Washington Wellness Training webinar on mental health tools you can use. We're really excited about today's conversation, and we're so glad that you've joined us. We're going to be covering a lot, but don't worry about furiously taking notes. We're going to post all of this in the meetings and materials section of our webpage in about a week. So you're going to have access to everything that we cover in the first hour. Next slide. So before we get started, let me introduce the team. My name's Kristen Steimanoff, and I'm the manager of the Washington Wellness Program. And we have 4 health promotion consultants on our team who each support specific employer groups. Heidi Helsley works with the public employer group. Erin Huff works with state agencies. Mandy LeBlanc, who is also our training lead and host today, works with higher education institutions. And Aubrey Bright works with schools participating in the SEB program. And we also have some of our colleagues from Limeade, the engine that powers Smart Health, with us. Heather Barrick is a customer success manager at Limeade who works closely with our team. Sarah Bell is a senior employee experience specialist, and she's been embedded with our team since 2020. And Jamie Wise is an employee experience specialist at Limeade, and she's been with our program now for about a year. She started last October. So Heather, Sarah, and Jamie are also all an important part of our extended team. Next slide.
It's not going to next slide.
Of course. Well, I will get it started, and I'm sure there we go. Okay. This is what we're going to cover today. We'll start by setting the stage, talking about what mental health is and why it's important. And then we're going to go through and we're going to hear from each of the health plans available to employees who are in the PEB and SEB programs and what they offer specifically around mental health support. We're also going to hear about some supplemental tools to maintain mental health, including employee assistance programs. And then from 11:30 to 12, we'll have an optional discussion time, networking time, but we hope that you will stay. It's always a really good conversation. Right, and by the end of today, we hope you'll learn a ton, but we hope that you'll at least walk away with these 3 things. We want you to feel able to explain what mental health is to anyone in your workplace or in your life and the role that it plays in our lives. We want to make sure that you can talk about at least 3 mental health supports that are offered by your own health plan, or if you are someone who shares this information with others in your organization, help them understand what's available in their health plans. And we also want you to be able to share resources with your coworkers so that they can focus on their own mental health. Before we dig right in, I'll mention a few brief housekeeping items. We are recording this webinar, so if you're not comfortable with it being recorded, you can exit and access the recording in about a week when we have it all up on our meetings and materials section of our webpage. We're using Teams today, as you know, because you're here, but we've turned off the chat feature during the presentations, and we'll turn it back on at the end. So if you have questions, jot them down for yourself and then pop them in the chat at the end, or you can, I think you'll be able to come off mute if you want and ask at the end, but there will be a chance for questions. And then, as I mentioned, all attendees will be, or I didn't mention, all attendees will be muted during the discussion section. So chat is off, everyone's muted, but once we get to the discussion section, I'm sorry, I just butchered that. Once we get to the discussion section, you'll be able to talk and chat freely. So now I'm going to hand it over to Mandy to introduce our first presenter.
Thank you, Kristen. Up next, we have Carolyn Thayer-Azoff. I first met Carolyn when we were collaborating in a wellness company. From day one, she was just someone I could be myself around, and I could see that her professional trajectory was going to be astronomical. She did not disappoint. Carolyn has a background in counseling psychology and more than 15 years of experience building strategies, programs, and teams in the mental health and wellness space across startup, enterprise, and Fortune 50 companies. Throughout the years, she has built an expertise in strategy and execution of culture-first, proactive, inclusive, and integrated strategies to mental health and well-being. Outside of her day job, Carolyn is a certified mental health first aid instructor, plant-based foodie, and mom to 2 young kiddos and a Frisbee-loving dog. Carolyn is one of my go-to people when I feel the need to strategize about wellness. She really leads her life in a way that I admire. So today you are in for a treat as she does a high-level overview of mental health. Take it away, Carolyn.
Thank you, Mandy. Thank you for that generous introduction. And I was just in my mind thinking about my dog leaping in the air this morning after his Frisbee. It's a good way to start the day. And thank you for having me here just to kick us off today. Again, really setting a foundation for mental health and mental health at work, and realizing that much of this is likely already things that you might know, but will hopefully just set the stage for why mental health is important for all of us as individuals, and as we're thinking about workplace strategies for mental health. And so what's on tap? Again, just making sure we're all on the same page. What is mental health? Why is mental health important? And then specifically narrowing in a bit on mental health at work and what the data is showing us in terms of opportunities and just a high level actions or considerations in thinking about how to promote mental health at work. Okay, so what is mental health? I love the World Health Organization's definition. It's a state of well-being in which an individual realizes their own abilities, can cope with the normal stressors of life, can work productively and fruitfully, and is able to make a contribution to the community. I'm sorry, I'm hearing an echo. I think that sometimes we can think about mental health being mental illness, but this is not true. Some people might use these phrases interchangeably, but we all have mental health, and you can click through to the image, Mandy. We all have mental health. It's on a continuum. It looks like maybe the image is not showing through, but from healthy to ill, right? And all of us are on this continuum, and for all of us, most of us, it ebbs and flows. And so it actually looks like this, right? Our mental health is not linear. We are not here or there. It can actually ebb and flow even throughout the day, and definitely throughout our lifetime. Sometimes mental health struggles are temporary. Sometimes they're longer term. Sometimes they might include a clinical diagnosis. And importantly, even on that further end of the continuum, recovery is always possible. It's important to recognize so 1 in 5 adults experience a mental health condition. This is not a kind of other situation. Many of us, 20%, are experiencing a mental health condition, right? And 92%, the vast majority of employees, experience mental health challenges that impact their work. And importantly, it's important to consider to keep in mind the impact of social determinants of health, the social determinants of mental health, right? And how this impacts our mental health and well-being. So how do the circumstances of people, of employees, impact and shape their mental health and their mental health outcomes? So think about, things like education, social inclusion, discrimination, right? Some groups, some racial and ethnic groups experience some of the highest rates of mental health conditions. And it's important to call out, especially, and we're going to narrow in a bit more on mental health and well-being at work, but, burnout. I know we've all likely, heard through our employees, read about the spotlight that is on burnout, and that's because 77% of employees have experienced burnout in their current job. And burnout it's a type of work-related stress, a state of physical or emotional exhaustion that also involves a sense of reduced accomplishment and loss with personal identity, right? And so this is, recognized also by the World Health Organization. And, of course, it can impact not just, a person's mental health and well-being, but also their ability to show up as their best at work, their work productivity. So again, we'll talk about things like ways we can empower people managers, but for example, keeping an eye out for team members, signs of burnout. Maybe team members being a little bit more cynical or critical at work. Maybe they're more irritable or impatient. They are less energetic. So things to pay attention to in the workplace. And then importantly, the declining mental health of our youth, right? 30% of young adults experience mental health concerns. And there's also declining mental health, again, for children and minors as well. Young adults have the highest rate of mental health concerns of any age group. Okay, so people are struggling, right? Rates of burnout, anxiety, depression are at record levels. And so how do we think about that at work, and how can the work and the workplace and the work environment promote and support the mental health of employees? A culture of mental health is defined. I'm just going to read it because I think it's helpful to kind of feel this, right? A non-judgmental, open, and supportive culture in which employees feel that the mental health and well-being are something they can talk about, seek help for, and nurture within themselves and others without repercussions. And I think that a key here is that without repercussions, right? There is still a stigma around mental health, and that can be amplified in the workplace because of the stigma or perception that maybe if I am struggling, that it might be, for example, a reflection of my ability to perform at work, right? And so employers are responding with benefits and resources, but if the culture does not align with and support, then the resources can only go so far. And so think about things like, just acknowledging the pressures, and maybe you can go back one slide, acknowledging the pressures on employees, putting preventative solutions in place, right? And cultivating an environment of acceptance and psychological safety through things like leader and manager trainings, even just communication and education, just like this. And then, of course, access to mental health, to holistic mental health and well-being resources. Okay, we don't need to belabor this too much, but there are plenty of opportunities and barriers just to acknowledge that employees are experiencing at work, right? I would pose these as opportunities, right? 70% of people say that their manager has more impact on their mental health than their therapist or their doctor. So think about ways that we can empower people leaders to promote and support their employees, and that includes their mental health and well-being, right? Think about, where do your employees, where do they live, and acknowledge the mental health professional shortages across the country, and even within our state, and think about how we can address those in meaningful ways. I mentioned the racial and ethnic disparities when it comes to mental health. So again, and I'll talk about a few ideas here, but really, if you are, with your mental health and benefits vendors, how diverse is their provider network, for example? Does that match what are people? And then again, the importance of a proactive approach. 11 years is the average time between the first symptom and the receiving of treatment. So think about all the opportunities to support and intervene upstream. Okay, so what can we do? I would suggest that you check out the World Health Organization's guidelines that were just released in 2022, but they really outline 4 key focus areas for mental health in the workplace. So number 1, prevent work-related mental health conditions. This starts with listening through employee engagement surveys, well-being assessments, pulse surveys. Where are the strengths and opportunities within your population? Talk to employee resource groups, have roundtables, and then respond to remove kind of more, to remove the top opportunities. Secondly, protect and promote mental health at work. So promotion of mental health and work, stress resilience, connection, community. things like coaching and tools, just for overall holistic well-being of mind and body, right? This is where people leaders can come in, and psychological safety. Thirdly, support people with mental health conditions to participate and thrive at work. So for example, partner with your accessibility team, right? I always like to think about, if I had to go out on leave for a physical health condition, how would we support that person? How would, as individuals and as a company? What about when they return from a physical disability leave? And just, the same goes for mental health. And then fourthly, create and enable an environment for change. So mental health does not belong in a silo. The importance of integration of mental health across the employee experience and across teams. That's why meetings like this are really powerful, to have the people in the same room to talk about opportunities for integration. So that can be across vendors, it can be even across departments. So partnering with your safety team, your customer service team. Why is mental health important to them, and how can we kind of integrate and promote mental health within their team that's important to their objectives and priorities? And that's a wrap. Thanks for having me.
Thank you, Carolyn. Thank you so much. All right, up next, we get to hear from some health plans who have pre-recorded their what they provide for mental health tools you can use. So without further ado, let's jump into Kaiser Permanente Northwest.
Services approach is unique to meeting our members' needs and is embedded within our larger medical system, specifically as part of our integrated care model. Our goal is to help our members reduce their symptoms while improving overall sense of well-being. And as a customer of Kaiser Permanente Northwest, your care may consist of one or more of the following services, which are listed here on the slide. Each of these services have various components built into them, which might include evaluation and consultation, complex medication management, consultation to primary care, might include some group or individual therapy, and inpatient and outpatient care. Health services include assessment, treatment, and support for a variety of mental health and emotional concerns, including attention deficit hyperactivity disorder, or ADHD, anxiety disorders, including panic and post-traumatic stress, autism, mood disorders, including depression and bipolar disorder, obsessive compulsive disorder, and schizophrenia. Currently, the Kaiser Permanente Northwest region has 12 therapist provider services, and these can be accessed 24/7 on the KP app. Appointments can be scheduled on that app with primary care or with the phone number listed there on the slide, and no referral is needed for these appointments. We also have a phone number specifically to connect with a mental health specialist. And then we have a website, kp.org/recovery, which can help members learn about options and get support specific to substance use. Members can get referrals to group therapy from their KP therapist or psychiatrist. And currently, these are being hosted virtually and are free of charge. We also have emergency psychiatric services, which are available 24/7 in our hospitals, and then we have a 24/7 crisis line phone number as well. Here shows a sample of some of our mental health and wellness groups. Currently in the Northwest region, we have a total of 102 groups, which are ongoing at various times throughout the week. As you can see here from this small sample, there is a wide variety of groups to help support our members. Our compassionate providers are leaders in their fields who have developed best practice guidelines in transgender health that are used throughout Kaiser Permanente. The patients do not need a referral to access our Gender Pathways Clinic and can schedule an appointment via the kp.org and online appointing system. We provide culturally competent care for transgender and gender expansive patients. The specialist team consists of a wide variety of providers, and they provide high quality gender affirming care in those different areas listed there on the screen. Spouse and family members on the plan are also able to access this clinic, and there is a copay and deductible that will apply for care. We have a suite of self-care apps that are available for our members. You can access them on kp.org/self-care apps. Listed here on the screen are 3 of the apps we have: Calm, My Strength, and Ginger. Spouse and family members on the plan are also able to access these as well, and they are no cost. I will let Kevin get into more details on each of these mental health tools during his section.
Hello, everyone. I'm Kevin Klein, Senior Workforce Health Consultant at the KP Washington region. Really thrilled to be with you today and to be able to share our mental health tools. KP Washington provides a multidisciplinary team approach to the treatment of mental health and substance use conditions for our members. And our unique approach to meeting our members' needs is embedded within the larger medical system, specifically as part of our integrated care model. Our goal is to help you reduce your symptoms and improve your overall sense of well-being. At KP Washington, your care may consist of one or more of the following services: psychiatric services, evaluation, consultation, complex medication management, psychotherapy services, which has assessment and treatment planning, care management, including RNs, skill building groups, psychological services, including video visits for psychology, chemical dependency services as well. All of this as part of Kaiser's holistic mental health service. There are several ways to access mental health services at KP Washington. You can see the list here of how to access mental health. The e-visit is very easy, very popular, and very wonderful to be able to give you all the information so you can make decisions on your own. And then chat online with a clinician that is a mental health master's level service level provider that can talk with you Monday through Friday, 8 to 6, and it is immediate. You can start chatting with a master's level social worker. Those are the best ways to get care. You can also call the 800 number listed here for consulting nurse, email your doctor, or get started online as well. Our really most popular way to get counseling is through group therapy. There are several counseling options available. On the next slide, I'll show you some examples of the different types of classes. These are available generally from 4 to 8 weeks, depending on the type of class that you're requesting. But the therapists can provide group visits specializing in patient needs for several different things for spouses, family members. They can also access and be on the call as well. And this is just a list of some of the mental health groups that we have for you, a sample list. Overcoming Adversity Mindfulness Group, just for general mindfulness, self-compassion, stress and trauma. There's parenting groups, some for kids with parents with kids that have ADHD. There's behavioral therapy, Thrive groups, healing from emotional pain, lots and lots of different things. You can self-refer to these. You can get a referral to from your provider, or you can just simply have access via the chat that you have access to. There are several ways you can get support for LGBTQIA or BIPOC populations. At KP Washington, we have gender affirming care throughout. We have had the first outpatient case management program in the entire country that started back when we were group health in 2015. So we always think about ways that we can incorporate that into care. And if there's any need you have, we certainly have you covered here. Now I'd like to end with all these tools we have, both available to you through KP Washington and KP Northwest in Oregon and Southwest Washington. All of these are member tools that are free. You can go to our website you see here at kp.org/selfcareapps, and all the list of these that I'm going to mention to you are listed here. So the first one is Calm, which is great for sleep, meditation, your daily meditations, sleep stories, types of music that are very calming. So there's lots and lots of different things available to you under the Calm app. And My Strength is really a cognitive behavioral therapy app, which is going to help you make those small steps for long-lasting changes in your life. It is really excellent for sleep, getting information around stress and all the things that you can really think about. How can I make life easier by making these small changes in my life? Ginger is our newest addition for our regions, and this is a behavioral health therapist that is going to be able to text with you. It is a live person, it is not AI. So if you think about that, having somebody in the middle of the night or 3 a.m. when you're having a panic attack and being able to text with someone at that moment, it's a really great service for everyone. And then find your words. This is our website from Kaiser Permanente National that is changing all the time. There's great testimonials on here about stigma reduction, being comfortable, finding your voice to find out what to say to somebody if you're not sure they're doing okay, or if you're not doing okay. It's really something that can help you find your words, and we really recommend that for everyone to see. It's a public website, so this again is for anyone who wants to view it.
Mental health tools you can use from Premera Blue Cross and Premera HMO. Premera Blue Cross and Premera HMO has options for in-person and virtual care therapy, covered the same way physical health is covered. To improve access to high-quality care, we offer a variety of care options. One-on-one mental health services include Boulder Care, Doctor on Demand, and Talkspace. Boulder Care is for substance use disorder treatment grounded in kindness, respect, and support for people over 18. Video visits and text messaging allow people to connect with clinicians, care advocates, and support 24/7. Co-pays and deductibles apply. With Doctor on Demand, you can video chat with a doctor or therapist for urgent care, preventative care, chronic condition care, and mental health care. It's for medication management, anxiety, depression, postpartum concerns, relationship counseling, trauma, and loss. Co-pays and deductibles apply. Talkspace is online therapy for members aged 13 and over with a licensed clinician via private message and live video. This is for non-urgent care, and co-pays and deductibles apply. Premera also offers more intensive levels of treatment for mental health issues, psychiatric disorders, substance use disorders when Premera Blue Cross and Premera HMO offers several one-on-one mental health. Group therapy is used to treat a wide variety of mental health issues and psychiatric disorders, depending on the areas of interest or specialization of each provider. In addition to group therapy, Premera Blue Cross and Premera HMO covers individual therapy, couples and marital therapy, psychiatric medication treatment, intensive outpatient programs, partial hospitalization programs, residential and inpatient treatment. Use our Find Care tool to browse our provider directory to connect with the right primary care provider, therapist, psychologist, or mental health specialist. These services are available to all Premera members. Co-pays or deductibles apply. Premera Blue Cross and Premera HMO plans include healthcare specific to the LGBTQIA+ community. These services include preventative care, HIV PrEP therapy and drug coverage, mental health care, and gender-affirming services. Use our Find Care tool to browse our provider directory to connect with the right primary care provider, therapist, psychologist, or mental health specialist. These services are available to all Premera members. Co-pays or deductibles apply. Additional services available to Premera Blue Cross and Premera HMO members includes the Matchmaker Behavioral Health tool. Matchmaker for Behavioral Health will connect you to a care provider based on your health plan, needs, and preferences. Any information you share with us is confidential. This service is available to all members on your Premera Health plan at no out-of-pocket cost. You can see providers in your plan network, both in person or virtually. Our behavioral health matchmakers offer the extra support needed on your care journey by providing a list of in-network outpatient providers who are accepting new patients. Co-pays or deductibles apply when you see a provider. You access this service by calling customer service at the number on the back of your ID card and request help with finding a provider. This is available to all Premera members. There is no cost for the service. Co-pays or deductibles apply when you see a provider. You may also utilize our Find Care tool to browse our provider directory to connect with the right primary care provider, therapist, psychologist, or mental health specialist. Benefits under the plans may differ. Sign into your account to review your benefit booklet for detailed information of your specific coverage.
Regents Blue Shield, mental health tools you can use. Regents Blue Shield mental health services approach. Did you know 1 in 5 people live with a mental health condition? 60% don't have the right treatment. 68% also have a chronic physical illness. Regents has designed behavioral health services that focus on a wide range of solutions with options like virtual therapy and integrated care management. Regents makes support simple, easy, and more accessible so members and their family can get the right level of care at the right time. Connection to care for members. There is a 24/7 nurse phone line. There's care management, which provides an integrated, personalized, and holistic model dedicated to delivering medical and behavioral health support to each member. Find more on the Regents website or call 866-543-5765. There's outpatient care, which provides office, virtual, and in-home options. And there's virtual services, which provides app-based tools, virtual tools, clinics, and counseling. Finally, there's Quartet, which connects members with face-to-face or virtual care in the appropriate modalities to improve health outcomes. Virtual behavioral health. Regents Blue Shield recognizes virtual therapy can be more comfortable than going in person, and it can also be a faster way to get care. Many mental health providers offer virtual appointments. The following slides outline network virtual care options for different member needs. Virtual mental health services. Emotional well-being to promote resilience and sleep and reduce stress and anxiety. Virtual solutions. HealthWise content. Access a library of articles and decision-making tools to help you understand mental and behavioral health issues. MyStrength. Emotional well-being in the form of building resilience, stress management, anxiety, sleep habits, and mindfulness. Offers individualized, evidence-based approaches 24 hours a day, 7 days a week. To get started, go to MyStrength, register. When prompted, enter access code PEB or SEB. Mental health services for members. Mental health support, offering condition-specific preventive care reminders, telebehavioral health, and navigation to the right provider. Virtual care provider solutions. Doctor on demand. Appointments with a psychiatrist or therapist by phone or live video chat. Accessible at the link through the regents.com experience or by phone 800-997-6196. Talkspace offers a range of virtual mental health treatment options to choose from, including online therapy, coaching, self-help tools, psychotherapy, and medication management for members ages 13 and older. Call 516-847-5432. Mental health services for members. Mental health specialty services offer virtual specialist access for LGBTQ+, trauma, and more with innovative solutions, provider engagement, and co-occurring medical and behavioral health support. Virtual care provider solutions. Able2 Therapy provides mental health care through an 8-week online therapy program. Sessions are one-to-one with a licensed therapist, and digital tools give you extra support. For members ages 18 and older, call 866-287-1802. NOCD provides therapy for obsessive-compulsive disorder through live video sessions with a licensed, specialized therapist. For members ages 6 and older, call 312-766-6780. Charlie Health, virtual specialty access for LGBTQ+, trauma, and more. Innovative solutions, provider engagement, co-occurring medical and behavioral health support. offered to ages 12 and up and works with families. Call 866-491-5196. Mental health services for members. Substance use support. Provides acute, intensive, condition-specific care, complex care, and residential inpatient care. Virtual care provider solutions. Boulder Care offers virtual treatments for substance use disorder with medication-assisted treatment, peer coaching, care coordination, and other recovery tools to members 18 and older. Call 866-901-4860. Hazelden Betty Ford offers substance use disorder and mental health treatment services, in-person and virtual therapy, high-intensity outpatient program, and medication-assisted treatment for members ages 18 and older. Call 855-900-9811. Eleanor Health provides acute, intensive, condition-specific care and residential inpatient. Call 866-746-7780. Charlie Health, virtual specialty access for LGBTQ+, trauma, and more. Innovative solutions, provider engagement, co-occurring medical and behavioral health support, offered to ages 12 and up and works with families. Call 866-491-5196. Mental health services for members. Eating disorders. Family support focused on treating eating disorders. Virtual care support. Equip offers support for eating disorders through virtual family-based treatment. Your 5-person care team includes a therapist, family member, peer member, medical provider, and dietitian. Call 619-350-6290. Mental health services costs. Services may be free of charge to access or have an upfront copay. Services provided may be subject to plan deductible and coinsurance. Balance billing may occur when care is provided by an out-of-network provider. Members are encouraged to review their individual summary of benefits and coverage, SBC, certificates of coverage, COC, and contact customer service 888-849-3681, Monday through Friday, 5 a.m. to 8 p.m., Saturday, 8 a.m. to 4:30 p.m. All right, that was Regents. Thank you to all the health plans for recording those, getting all that important information to us. Let's just take a deep breath here. That was a lot of information. As we transition into 2 opportunities for you in case that was, since that was so much information, we wanted to pass along that these 2 websites, which by the way, we are recording this, we'll be saving the slides. So don't feel like you need to furiously take notes. And when we send out these slides, there will be these 2 links that have information ongoing for behavioral health by services by plan for PEB and behavioral health services by plan for SEB. So take a deep breath, know that we have all this information cataloged, ongoing and constantly being updated in a centralized location, but we'll also send out all those details in about a week. Up next, stick with me a little bit longer, we have supplemental mental health support. We felt that we needed to include information about employee assistance programs as well and mental health technology tools. What is the Employee Assistance Program? For almost 50 years, the Washington State EAP has supported the well-being of public employees to promote a resilient and productive workforce. It's been needed more than ever these past few years. The Employee Assistance Program website is eap.wa.gov. The phone number is 877-313-4455. What concerns can you bring to the EAP? I am always surprised at all the things you can use for EAP, and you're allowed to have at least 3 calls per topic, so focus on that. And they're there to help you for various needs throughout your life. So life and work changes, stress management, financial and legal concerns, relationship improvement, family and parenting issues, grief and loss, domestic violence, anxiety and depression, substance misuse, bullying and harassment, crisis support and management. A lot of people don't know that you can also use the EAP for organizational consultation for supervisors, leaders, and HR. I'll cover the ones on the left, and I'll give you a moment to just read the ones on the right after I'm done. For supervisors, leaders, and HR, you can use it for advice, problem solving, coaching, support, resources, and employee referrals on many different topics. I'll let you read those on the right for a second. EAP can also help with crisis response, so critical incident stress management, providing immediate support and guidance to leadership in the aftermath of a traumatic event. Group sessions, a voluntary facilitated discussion to talk about what happened, the impact on the team, and promote self-care. I've seen both of these utilized with excellence. Also, they can provide support on work-life resources. They have web resources. They have legal assistance. They have financial counseling. The bottom line is that the EAP is there to support you. Free to you and your family, confidential, easy to access, expert professionals, practical help from everyday concerns to serious issues, caring and respectful, culturally relevant, supporting the whole person. We just wanted to note that there are other EAP options available. All state agencies have access to engage with Washington EAP programs. Here are a handful that some non-state agencies are using. ComPsych Guidance Resources, Magellan, First Choice Health, Deer Oaks. We wanted to include some additional mental health resources. So the health plans cover a big aspect of it, and we get healthcare. We have various options that you've heard today. We have the EAP, and then sometimes you just need to go and look for a good article or something to help in that moment. So we want to provide some resources here. Again, these will be sent out in about a week with this recording, but also with the slides. When in doubt, there's also the crisis line, 988. Our learning objectives for this training were, by the end of this webinar, we hope that you've been able to explain what mental health is and the role it plays in our lives, thanks to Carolyn, describe at least 3 mental health supports offered by your health plan, and share resources with your coworkers so they can focus on their mental health. All right, it's time to open up the chat where Kristen will kindly put in the evaluation link.
The link is in, Mandy.
Great. Kristen, I feel like I'm in a battleship.
Sorry,
Kristen,
I didn't verbally say that. Yes, I added the link.
Great.
We definitely appreciate all of you filling that out. We truly attend to that feedback and use it to try to make things better. And we tried some new things today. So we're really interested to hear what you thought of them, the sort of mix of in-person and pre-recorded, et cetera. So if you have a minute, take the survey and fill it out for us. Mandy, there's a question in the chat. Maria Royal asks if there's a cost associated with the crisis response facilitated by EAP.
Great question. If you're engaged with the EAP programs, then I believe that's included. I'm saying believe just to cover my bases, but I'm pretty sure. Oh, Carly, yes, Carly from the EAP is raising her hand. Can give a try to speak so you can answer that.
All right, can everybody hear me?
Yes.
Perfect. There is no cost associated for any service that you reach out to for EAP. So we are 100% free across the board for both you as the employee and for your household family members as well.
Thank you, Carly. Spoken right from the expert.
And I think we do need to keep emphasizing that the Washington State EAP, which is available to all state employees, and that some other organizations contract with, I think that's what we're talking about here. And if your organization has a different EAP, we definitely encourage you to make sure you know what the parameters are of that. Because Maria, for example, if you all use something other than the Washington EAP, you might want to just get confirmation about whether crisis response is also included in that.
Good call. When in doubt, read the contract.
Yeah.
Okay, I'm just going to switch as people are filling out that evaluation. Thank you. I'm going to switch to things that we also, so that evaluation asks some questions, but if you have other things that any other feedback you want to send that email to me, mandy.leblanc@hca.wa.gov. We've put some questions in there just to fuel your brain, but I love hearing what you thought of things. Hey, I love this. Did not care for that. That helps us improve. So that's just a reminder to send the email with any other questions outside of the evaluation link. And I am yeah, go ahead.
We do have another question in the
Great.
chat. Can we take a couple minutes to go through those?
Sure.
Okay, good. Right now, we just have one additional question. It's from Chris Alanis, and Chris says, this is good information. This is my second school district. Most wellness information surrounds teachers. Is there anything specific we can use to help the district office support staff? Is there anything specific we can use to help district office support staff?
I can take this answer. Yeah.
Go ahead.
So in my previous life, I worked at a school district, and it was my role to help people spread the word about mental health tools you can use. So that's why I wanted to put together this training. So I would say when we get the PDF, you'll get the PDF emailed to you in about a week. And taking that and dissecting what works for your school district. I already saw a text come in to my phone about what resources can we get to a certain school district from somebody else. And so take that PDF, condense it obviously into, and see if you can share that with your managers to get the word out about specific mental resources. So we wanted to provide lots of information so that you could then say, all right, this is what applies to our school district. So does that help answer your questions? And I think that we'll also have a resource in the meetings and materials in about a week. A little condensed. Does that answer? If that doesn't answer your question, feel free to put a more specific question in the chat.
Chris said thank you. And Chris, I also made a note in the chat for those of you who are at schools or school districts that are part of the SEB program. Want to remind you, I mentioned at the beginning, the health promotion consultants on our team who support the different employer groups, but Aubrey Bright is our health promotion consultant who supports SEB, and she can do a lot of, brainstorming with you one-on-one. So definitely connect to Aubrey if you want some individual attention.
Shout out to Aubrey. She's doing an amazing job.
We've gotten lots of nice, great information. I'm not seeing new questions at this point, but we're getting very nice feedback.
We will have time for questions as well. So don't feel like if I'm going to move on because I'm excited about some people that are going to speak about how they've infused mental health tools. So just know that I'm not skipping over you. We still have that networking half hour if you can stick on. All right. Unless there's a burning question, I'm going to scooch on to the school district.
Let me say one more thing,
Sure.
Mandy, before you scooch on, because Heidi just put a really key resource in the chat that I want to make sure everybody knows about. It lists out behavioral health services by plan, and it's just a good kind of compilation of stuff that you can start perusing today. So take a look at that.
Thank you, Heidi.
And now I will be quiet.
Okay, the reason I'm so excited is because up next we have the Central Kitsap School District, and I'll just give a quick overview that we had a call with the members of their team to see if they would be a good fit for the networking time. I was thinking, all right, yeah, let's see what they have to say. And at the end of the call, we were all laughing, sharing stories. One story brought a tear to my eye, which hopefully they'll share. But I just wanted to say that the Central Kitsap School District is doing some amazing things, and I'm so excited to introduce you to Andrea Bauman and Jeannie Becken. Take it away.
Hi there, friends. My name's Andrea Bowman. I'm Assistant Director of Student Services. Jeannie?
Hi, I'm Jeannie Becken. I'm the Assistant Superintendent of Human Resources.
Thank you for a few minutes. We're just going to take about 5 minutes to kind of give you a little bit of a history of how we've come to do this work and then what is our current reality. And of course, someone's wanting to call me right now. That's the phone you're going to hear. But anyways, I just want to jump in a little bit, give you a little history, and then Jeannie will talk about current reality. I'm going to turn this down so that that person can get my call later. Okay, so what are we doing? Why are we doing it? I want to go back in time. So as you recall, the magical time of 2020, Yeah, you all know that date, don't you? The pandemic hit. And we were given guidance from the state to run at all kinds of supports, and every district was experiencing this. One of the categories that we needed to attend to was well-being, both for students and staff and families. So how did we were going to handle that? My role in our district is our multi-tier systems of support, positive behavior support, social emotional learning. So our district said, well, Andrea, it's yours. I'm like, so what did we need to do? We needed to put together a team. We needed to get people who knew what they were talking about. And it wasn't my background. Behavioral health is not Andrea Bowman's background. So what did we do? We put together a team, administrators, classified staff, certificated staff, a school counselor who has a background in behavioral health, but we also, and this is really critical, there's a framework out there called the Interconnected Systems Framework, and it talks about school districts integrating behavioral health, mental health in their multi-tier systems of support. So that was a mental framework for me. So I knew to pull in Kaiser Permanente, not Kaiser, sorry, Kaiser's a different piece, but Kitsap Mental Health and Peninsula Community Health Services, we'd already started to have partnerships with them. So I pulled in therapists from them, and then we just started to figure out, okay, well, what's going to be the need? We weren't going to make it up, right? We knew enough about trauma informed. And one of the first filters kind of had two thought pathways on how we support staff. One pathway is trauma informed and the work of Dr. Bruce Perry. So the 3 R's, regulate, then relate, then reason, right? Like the brain states, right? And then we know we can't reason well if we're not in the right brain state. We have to be regulated so we can then relate. Prefrontal cortex. So we knew we needed to attend to that. And we knew that during COVID, how were we going to, one, help people regulate virtually? And then how were we going to get people to relate virtually? They weren't going to be around each other. So how are we going to fix that? And then the second side of it was staff self-efficacy, a sense of control. When things feel like they're out of control, like we know that also provides like stability. So on the control side, we just said, hey, how do we give some choice and voice to staff to make priorities over the work effort, to maybe look at reducing some redundancy. So that was over here. I would say a lot of our effort still has continued to be on the trauma-informed side of relate and regulate. And then we were in COVID. So what was going to be our pathways? The first part was we had to frame up what we meant by regulate and relate. So regulate for us came down to 3 behaviors to regulate: breathing, movement, mindfulness. So we knew we could instruct to that. Okay, check. That's concrete enough. We can do something with that. And then relate was going to be things like, how do we establish relationships, maintain them, and restore them? And how were we going to do that virtually? So our question is, how do we increase access and opportunity to those things I just described? So both regulation activities and learning and relationships. So how did we do that? We started to create virtual social activities. So we sent out a survey. We said, hey, staff, what are you into? What do you all like? Do you want to go for walks? Do you want to learn how to bake something online? Like literally anything. We were just curious what would make people feel like they would have a social connection. So we did everything from painting rocks and virtual, paint and sips to social distance walking. Like we just really tailored it to what the staff said they wanted. So we ran at that. We created a website. And then what you're seeing in the image down below is a QR code to that site. And I believe, Mandy, it did work, right? Like if you tried it out. So yes. If you guys want to go check out our CK Wellness site, by all means. So in there, you'll see that we've organized some resources on foundational understandings about well-being, but even really concrete things like a virtual calm room where people can interact on it. There's resources for who to call if you're under crisis or you need mental health supports. There's additional extended learning, like I want to learn about some apps or some podcasts. So we wanted to make sure we had a way that people could both access relationship, but also access resources. And then the third thing is we didn't want to base this all on whatever our opinion was. We were following evidence-based practices and we were looking for what the experts were saying. So whether it was Kaiser Permanente or Alliance for Healthier Generation, we were following UW Smart Health Center provided guidance during that time. So we were trying to pull out the best ideas and then just trying to ferret out like what would staff need. Then the next thing that we had to think about, and this kind of moves into our current reality, so I'm going to pop that over to Jeannie now, is how are we going to go from just this website that was going to sit over there, and how are we going to reinforce that people knew about it, are engaging in their well-being, and then how are we going to monitor that? So things have now shifted out of COVID, of course. We've still proceeded. How did that happen? So Jeannie, off to you.
Well, I'm sure all of you can see why Andrea was the right person to help lead this work when we found ourselves in a pandemic and needing to connect. So she may not be a resident titled expert, but she has just opened up a whole world of conversation for our school district about how we support the mental health and well-being of our students and our staff. So along with this, coming out of the pandemic, or in the pandemic, we had House Bill 1363 that came out, which required our school districts to adopt a policy, 5515, which required us to put together a workforce secondary traumatic stress committee. And so we have done that, and we are certainly learning along the way, but we have a lot of committed professionals who have agreed to come sit on this committee to help support our work. The committee is comprised of district leaders, to include myself and Andrea and other district leaders. We have a behavior specialist who works with students on the committee, a school counselor, our equity specialist, a classroom teacher. Both of our union presidents sit on the committee, as well as a representative, a supervisor from Kitsap Mental Health and Peninsula Community Health Services. And we are trying to take this website, and we've developed some goals that we want to accomplish in this first year of really just advertising and getting the word out, and getting some more robust goals put together. We have a partnership with Kaiser Permanente, who provides us with some resources and some training, because we are not experts in this field. And so their partnership has been valuable to help us learn more. And really the goal of the committee is to help support the mental health of our workforce, which every organization is working to do as we come out of this pandemic. Along with the EAP resource that everyone was talking about, we also, during this pandemic, through our ESSER funds, did e-therapy access for our employees. And we are working now that the ESSER funds are no longer available. We are working to see how we can continue to combine that with our EAP services, so that our employees have access to additional e-therapy if they choose to take it. So the last thing I want to share is, coincidentally, we happen to also have one of our executive leaders who found himself in a place of needing help and support last year. And he will describe it as having one of the most difficult years of his life. He accessed a lot of help and support as he was going through this personal crisis. He reached out to everyone and anyone who would provide him help in e-therapy, in-person therapy, group therapy. He read, he listened to podcasts, he accessed as much help as he could to help him get through a very personal, traumatic event last year. Coming into this year, he was willing to share his experience with our school district staff. So through a variety of venues, we have had an executive leader show incredible vulnerability and put together what he calls 16 life moves that he learned throughout all of the therapy and all of the reading. And he's just shared things that has been helpful to him in his journey of wellness. And he has shared that in groups, our certificated staff, 300 people sitting in bleachers, listening to him be vulnerable and share what he's learned. He has provided that professional development to our custodians, to our secretaries. He's about ready to share it with all of our paraeducators. And the impact of what he has shared has touched this organization in a way that I have never witnessed in my 38 years here. He has people thanking him for showing him that it is okay to need help and to ask for it. He has shown that you can be in a top leadership position and need support and help and not have it all figured out, and to describe yourself as a messy human. And so that vulnerability has set our organization, I think, on a trajectory where people are finally realizing it is okay to access, it is okay to reach out and ask for help. It is okay to talk about the things that you're struggling with your colleagues and with other professionals. So when you were talking about relating, so many people have related to the experience that he has shared. It's been a game changer for us.
Thank you so much, Jeannie.
Yeah.
Andrea, did you have anything else you wanted to add? That was, I don't know how you top it, but if you have any final thoughts, go for
Yeah,
it.
you don't top the reality that a top leader is exposing themselves emotionally in front of the entire organization. I'm sure every organization has this, but I mean, I've been in education for 25 years. I've never seen a top leader do that ever. We were told we weren't supposed to do that. Honestly, it was kind of like there was a sense that you think that if you come up with confidence and you feel like you're supposed to know everything, and you can't reveal that you're vulnerable and human and may not, like, you just get that sense. And we've now just learned the opposite is true. That the more we, obviously there's such a thing as also oversharing. There's context, and he didn't overshare. He shared just enough to give people understanding that he had very difficult time and he had to walk through that and create a plan. And what I appreciate about that too is I wasn't sure when I was trying to work through the technical side of things, like create a website, understand the practices, try to get that promoted. How did I get people willing to go look at it? Get people willing to create their plan? Because one thing we kept hearing is you're not supposed to use the word self-care anymore because that was a dirty word. Well, yes, if you're asked to do self-care without the organization to support you doing that, and really demonstrably showing they mean it, then people don't believe you. And it just feels like another task you're giving them. And I think probably the biggest gift was our top leaders showing that they mean it because they're walking through it. And that changed the trajectory. We, on our website, we're trying to incentivize people going to it. It's not just communication, but we're like trying to offer prizes. And it was one way for me to track if people are actually going to the site. And I could not have told you how many at all went to it during the COVID years. I don't know if they ever did. They acted like we didn't provide it, so I think they must not have gone to it. But now, I mean, I already know, like just last week, we had 50 employees already on it in the last couple of months, which, I mean, sounds maybe not like a lot, but honestly, it's a lot because there may have been more. They just didn't fill out the form, right? But it just shows like people actually are going to it now. Why? Not just because we put it in our e-news, because there was some relational moment that people believed us that we cared.
Thank you, Andrea. I favorited it myself. It's such a great tool. Thank you so much. I couldn't have asked for a better explanation of how you've implemented the mental health tools and amplified other resources as well, plus the personal story. So thank you so much. Aw. All right. So I think Andrea and Jeannie are going to stick on just in case there's some questions. We will jump into our questions and networking time. So the questions we've posed here, don't stop here, you can keep going, but how do you plan to use this information? How could you share this with your coworkers? And how can you promote getting mental health support as needed? Andrea just gave some examples, and Jeannie, but let's just jump into, first, let's see if there are any questions. Somebody's been stuck and they would need to have an answer before we can move into networking. How's the chat going?
We have some nice comments in the chat, but no questions.
Great.
Maria said, what a powerful example for your employees to see, such a gift for him to be willing to share. And if we ever hear whispers of people feeling guilty for using these resources, including taking time off to access them, we'd like to remind people these things are part of their employment agreement. You're meant to use them. I think that's a really important comment.
All right, so unless there are other questions, we get to jump into freestyle a bit, jumping on to say how you're going to share this information with your coworkers, how you plan to use this information, and how you can encourage others to get the mental health support they need. Freestyle time.